So hi again to everyone. So let us now proceed to our third topic for this week. So let us now discuss interviewing and communication, which is very important in doing your health assessment because you are gathering data. You are gathering data through interview and communication. So health history interview is a conversation with your patient with a purpose. Hindi lang po siya bastang chika lang or marites lang. Of course, it is a conversation with a purpose because you are gathering data about the client. Okay, that will serve as your baseline for your nursing care plan. Okay, so it is different from social conversation wherein in doing social conversation, okay lang, or as a nurse, you are free enough to talk about your feelings, your interests, yan. But when we say health interview or health history interview, the primary goal of this is to improve the well-being of your patient. So, ang focus natin is yung ating pasyente. So, what is the purpose of health interview or health history interview? Is to establish a trusting and supportive relationship or therapeutic relationship with your client to gather information and to offer information. So that is the purpose of doing the interview and communication with your patient. So there are 4 phases of interviewing. So it includes the pre-interview, of course, the introduction, the working phase, and the termination. Okay. So during pre-interview, the nurse set the stage for smooth interview. How can you do this? By self-reflection. So paano ba yung self-reflection? So you should be aware of yourself. You should be aware of your feelings, diba? Para hindi ka naman baka bigla kang mag-breakdown while you are having a conversation to the client, lalo na kapag nakaka-relate ka doon sa patient, sa kanyang story of your client. You have to review the patient record. You can check the chart of the client, okay, bago mo gawin yung actual interview. Why you need to check or review the patient record? Kasi it will provide data. No, may data ka na. So, alam mo na what would be your focus later on. Pero, hindi yung ibig sabihin na nakafocus na agad yung tanong mo pagdating mo sa pasyente. At least you have an idea about the client, of who is your client and why your client is there. Diba? You have to set an interview goals. Ano ba yung goal mo in the interview? What are the data that you need? Okay, so review on clinical behavior and appearance. Okay, the way you react, the way you talk, and the way you dress. Okay, you adjust the environment. Baka kailangan mo i-adjust yung temperature, yung lighting, baka masyadong madilim. Okay, or baka masyadong maingay, baka kailangan mo ng isang corner to interview your client privately. You have also to take notes because hindi naman po computerized ang ating mind na i-record mo lang. Okay? You have to jot down. Kailangan isulat mo yung mga informations, especially the vital informations. Okay, let us now move to the second phase of interviewing, which is the introduction. As a nurse, you have to put the patient at ease and you have to establish trust. Okay, how will you do this? By greeting the patient and establish rapport. Okay, paano po ba yan? Diba, if you remember, during your first semester, lagi ko kayong tinuturuan of how to be courteous. Kasi this is very important. Kasi pag pupunta ka doon sa client mo, ang bibigat-bigat ng mukha mo, of course, you think the client will be comfortable enough to share the data that you need. Baka hindi, baka tarayan ka ni patient. So, paano po yung greetings mo to the client? Good afternoon, Mrs. Chase. Okay, you have to address your client by name. Mali po yung good afternoon nanay, good afternoon tatay, good afternoon ate, lola, lolo, mali po yun. Yes, sa Pilipino, isang paggalang yun. But you have to be formal, you have to be professional. Okay, you have to greet your client by addressing the client's name. Good morning, Mrs. Chase. Kapag nakita mo naman when you enter the room of the client, meron siyang kasama, may visitor siya, of course, dapat i-greet mo rin yung kasama ni patient sa room. Okay, good afternoon, ma'am. Good afternoon, sir. Kung hindi mo alam yung kanilang first name. Okay? And then, paano ba mag-establish ng rapport? Okay, trust sa client. Okay, syempre, kailangan mag-provide ka ng privacy, no? Explain mo na confidential naman yung whatever data that you will get from the client. It will be shared only to the appropriate person na kinakailangan for the patient care. Ayan. So, i-assure mo yung confidentiality of the patient. Halimbawa, may kasama si patient sa kanyang room. Okay, habang ini-interview. Maybe you can ask permission to the client. Is it okay na interview kita while your sister? Is it comfortable for you that I will proceed with the interview? That your sister or your brother is around. Okay, kapag okay kay patient, and then you can continue. You can also state that you are comfortable naman as a nurse to interview the patient, but your concern is the patient, kung okay lang sa kanya. And then you establish the agenda of the interview. How will you do that? Okay. You can do this by asking an open-ended questions to your client. So, pwedeng tanungin mo siya, what concerns bring you here? Diba? Parang itatanong mo, or what concerns bring you here today? Yan. How can I help you? Those are example of establishing the agenda. Kasi from there, sasabihin na ni patient, no? Generalize na yung, it's an open-ended question, nasa broad ka muna. Yan. Tapos, ayun, mag-share na si client ng kanyang reason, bakit nandun siya. And from there, you can ask specific questions na. Okay, masasala na natin yung kanyang questions. Ay, yung mga interview. So the third phase of interviewing is the working. In this phase, the nurse obtains patient information by inviting the patient's story. So kanina, nung nag-establish ka ng agenda, you ask a general or an open-ended question, general question, like for example, di ba, sabi natin kanina, what brings you here today, or how can I help you? So this time, sinabi ni client, for example, in here because I have pain on my abdomen. Yan. So, in inviting the patient story, pwede mong sabihin, or you can ask your client, can you tell me more about your pain? Okay, and so on. Marami ka nang pwede itanong dyan. And identify and respond to emotional cues. Parang naiiyak-iyak ba si patient? Or you have to be attentive. Diba? Dapat you show that you are interested to the client. No? Parang, you can sasabihin, can you go on? Yan. Expand and clarify the patient's story by using the following. Okay, the old card or the QPRST. Old card or QPRST is the 7 attributes of the symptoms. Ayan, kanina sinabi niya, may pain siya. Diba? May pain. May pain si patient, kaya nandun siya. So, old card stands for, ayan, this is the mnemonic for symptom assessment. Your old cards. Okay, onset. Okay, acute versus gradual. So, sinabi niya kanina, she is experiencing pain. Okay, so pwede mong sabihin, when did it start? Kailan po nagsimula? Okay, kailan niyo po nasimulang naramdaman yung pain? Okay, the onset. The location of pain, where is it located? Can you show it to me? Okay, ipapoint mo sa kanya. Saan ba yung masakit? Yan. Dito po sa aking lower abdomen, is it on the right or on the left? So, mas maganda ituro ni patient. So, duration how long that it lasts. Gaano po katagal yung sakit? Umaabot po ba ng 1 oras? Umaabot po ba ng 15 minutes? And so on and so forth. What is the characteristics of the pain? Is it severe? Is it, can you rate your pain? Pwede mo ba i-rate yung pain kung gaano kasakit? 0 as no pain, 10 as the worst pain. Ayan, characteristic. Aggravating factors or associated manifestation. Okay, aggravating factors or associated manifestations. Okay, have you noticed anything else that accompanied it? So, pag sumasakit po ba yan, may iba pang nararamdaman. Ayan. So, relieving. Okay, relieving factors. Ayan, or exacerbating factors. You can ask the client, is there anything that makes it better or worse? Ayan. So, ano po ang ginagawa ninyo? Ano yung relieving factors? For example, ano po ang ginagawa ninyo kapag sumasakit po ang inyong tiyan? Okay? What are the treatment that you use? Diba? Ano ba? Anong ginawa po ninyo? Anong ininom po ninyo? Is it effective? So, that's the treatment. Severity, katulad na yung sinabi natin kanina, kung gaano ba kasakit yung scale. Okay, the pain scale. So, this is another example of your old card frameworks by CD et al. 2003. So, the description and the question to ask to yield the information. For example, onset. So, you can ask your client by asking, when did the pain begin? For the location, you can ask the client, where is the pain? Can the patient point to the location of the pain? Yeah. And then the duration. How long does the pain last? Is it persistent or intermittent? For the characteristics, you can ask the patient to describe the pain. Is it crushing, stabbing, indigestion-like, dull, or ache? For example, yeah. Associating factors. What other symptoms associated with the pain, such as nausea or vomiting, weakness, fatigue, breathlessness, syncope, feeling cold, and clammy? Remember, if you're asking too many questions, like for example, itong vomiting, weakness, you have to pause para makapagsagot muna yung patient mo, no? Hindi yung tuloy-tuloyin mo yan. Baka sabi niya yes, no, it will lead to a confusing answer. Okay? For the relieving factors or radiation, you can ask the patient, does the pain radiate, such as down the arm or up to the neck, for example? You ask them, does the patient stop when activity ceases, or is it relieved by sitting forward, or resting? So, treatment or temporal factors. Is pain relieved by rest or a decrease in physical activity? Is it relieved by the use of glyceryl trinitrate? Is pain comparable to previous ischemic chest pain? Yeah. Severity or intensity. A numerical scale, 1, no pain, or 0, to 10 as worst pain experience, is used to gauge the severity of pain. Here is another example of your pain scale. No? Ito yung 0 to 10. Yan. 0, from the facial expression pa lang of the client, makikita na natin. So, kapag yan, nakasmile pa si client, ayan, yung pain niya is 0 pain. Ayan, kapag medyo nakasimangot na si client, ayan, moderate pain na yan. Okay? Pag severe na yung kanyang pain, from 7 to 10. Okay, ganyan na talaga yung facial expression of the client. If the client is crying na talaga, maybe you don't need to ask the patient to rate the pain scale. Baka masampal ka na yan, umiiyak na nga yan, or nagsisigaw na si pain. So, you can consider it as number 10. Diba? The third phase, continuation of our third phase, generate and test diagnostic hypotheses. Okay, and then how will you do that? So this, you can do this, you generate and test a diagnostic hypothesis. You can compare it into a cone. No, parang cone lang yan. You ask a general questions. Okay, yung first opening of the cone, ito yung open-ended question muna na itatanong mo. And then to a more specific questions, and then yung pinakamaliit na opening doon sa cone, yung finally, ito na yung yes or no response question ang gagawin mo. Okay? And then create a shared understanding of the problem. Okay, you need, importante ito to have a therapeutic communication with your client. You need to understand, you need to acknowledge the feelings of your client, the ideas, the function, and the expectations. Okay. So you have to negotiate a plan including a further evaluation, treatment, education, and self-management support and prevention. So kailangan aware din si patient about your plan of care para aware siya at maging cooperative din siya. So the fourth phase of your interviewing is the termination phase. In termination phase, the following are very important. You have to summarize the important points. And then you have, again, to discuss the plan of care to the client. So, sasabihin mo na doon sa termination phase na, I need to end this conversation, but let me summarize to you napag-usapan po natin kanina the 3 days at 3 days prior to your admission, you were experiencing a pain on your right lower abdomen, and the pain scale is 7. So, isummarize mo lahat ng mga pinag-usapan ninyo. And then, you discuss kung ano yung plan of care to the client. Ano ba yung magawin ni client? Ano ba yung mga gamot na dapat i-take ni client? Ano ba yung mga techniques to lessen the pain, the breathing techniques, yan. So, naggagawin ni client. So, you have to discuss that to your patient. Okay. So, those are the techniques in therapeutic communication. Okay, na kailangan natin when you do an interview para maging harmonious yung nurse-patient relationship, and you can get the data that are necessary in your plan of care. So, active listening. So, pag sinabi natin active listening yan, you are showing interest to the client. Of course, ano bang interest yun? Baka ibang interest naman yung iniisip mo. That you are interested to the story of the client. That you are interested to listen to the client. Okay, guided questions. So, dapat may na-develop ka ng questions na ito ang magiging guide mo. Okay, to get the data of your client. The non-verbal communication, okay, by you can, ano ba yung mga non-verbal na pwede natin gawin? By nodding, ibig sabihin, you are asking the client to continue to go on, no, para makapag-tell pa siya ng story. Okay, i-avoid natin yung mga non-verbal communication that is offending to the patient. Empathetic response, like for example, I understand how you feel. Yan. Validation, you have to validate that the patient feelings is, for example, sinabi ni patient na ganito, katapos lang ng car accident, wala naman akong sugat, pero ito pa rin yung nararamdaman ko, natatakot ako. So maybe you can validate the client that what she or she is experiencing is just normal because of probably because of the what she had experienced about the accident. Diba? Nakakatakot talaga yon. And then reassurance. You have to give reassurance to your client but avoid giving false assurance. Okay? Summarizing. Nasabi na natin yung summarizing kanina, that you have to summarize kung ano yung mga napag-usapan ninyo ni client. And then transitions. Kapag kailangan natin mag-shift to another topic, you have to inform the client. No? Tapos na po tayo dito sa inyong head. Ngayon naman po, ang aking i-check ay inyong chest. Ayan. So, alam ni client, nasa chest ka. So, she or he is aware, nasa chest ka na. At sasabihin mo, I'm going to touch your chest. Ayan, kasi you will do the palpation. Ayan. Empowering the client. Okay. You can do this by conveying interest in the person. Not just the problem that the person is talking to you. So, maraming way to empower to your client. You can make your clinical reasoning transparent to your client as well. So, that's an example of how you will empower your client. So, let's move on to interactional skills. Okay, these are the skills, the technique, and example. Okay, for the skills, or attending or giving the patient undivided attention. You can, what are the techniques that you will use? You can use direct eye contact, or you can lean forward or toward the patient slightly para you can hear, di ba? Select a quiet area, convey in hurried manner, avoid fidgeting or looking at your watch na parang nagmamadali ka, you're in a hurry. Alam naman natin na lahat tayo nagmamadali, but you should be dapat na iayos mo yun, hindi mo masyadong ipapahalata sa kanya. So, pwede kang mag-set na at the start pa lang, pwede mo lang sabihin, Mr. Chase, I'm here to interview to you. We have an hour or 30 minutes to talk about your problem. So, and then example, nurse sits facing the patient, remains alert, and focuses on what the patient is saying. Hindi mo isushow na parang iba-iba na yung iniisip mo at hindi ka na nakikinig doon sa patient. So, another skills, yan, paraphrasing or restating the patient's message to test whether it was understood. So, the techniques that you will use is to listen, restate it in your own words, or you can ask the patient if your words are an accurate restatement. For example, the patient said, I toss and turn at night. So, parang, di ba, you can restate it. It sounds like you're not getting enough sleep. Yeah. And then, direct leading or directing the patient in order to obtain specific information or to begin an interaction. So, the techniques includes decide what you want to explore. Ano ba talaga yung gusto mo? Tell the patient what you want to discuss and encourage the patient to follow your lead. Okay, so pwede mong sabihin, let's discuss the pain in your back. Focusing. Okay, you have to help the patient zero in on a subject or get in touch with their feelings. You can use the following techniques by use focusing when the patient strays from the topic. Nawawala na siya. Listen for themes, issues, feelings in the patient's rambling conversation. Okay, ang dami-dami niyang sinasabi kung ano-ano. You have to find kung ano yung very important information doon sa kanyang mga sinasabi. Ask the patient to give more info about a specific theme, issue, or feelings. Okay, by asking, describe how you feel when you can't sleep. And then, questioning. So, gather specific information on a topic through the process of inquiry. You can use open-ended questions, avoid questions that are answered by yes or no, or you can ask the patient to express the feelings about what is being discussed. Or you can ask the questions that help the patient gain insight. Example, what did you mean when you said your back was breaking? So, ano po ba ibig mong sabihin yan? So, the patient will give you information. So, elaborative yung kanyang isasagot sa'yo, hindi lang yes or no. And from there, nakakuha ka pa ng more information. And then, reflecting. Okay, you have to let the patient know that the nurse empathizes with the thoughts, the feelings, or the experiences expressed. Okay, take the patient's feelings from verbal and non-verbal body language. Determine which combination of cues you should reflect back to the client. Ano ba ang cues na nakita mo. Observe the patient's response to the reflected feeling. For example, for the feelings, I must be prostrating not to be able to get enough sleep. And in your action, you are yawning, you must be tired. Yes. Example. Summarizing or tying together the various messages that the patient has communicated throughout the interview. Okay, you can listen to verbal and nonverbal content and then summarize the feelings, the issues, and the themes and repeat them to the patient. For example, let's review the health problems you have identified. Yan. Isa-isahin mo ngayon. So if we have techniques for an effective communication, we do have barriers to communication. And these are the false reassurance. So you're giving a false reassurance to a terminally ill client, no? Sabihin mo, everything will be okay, kahit alam mo, hindi naman talaga. So, that's a barrier to communication. Passing judgment. So, wag kang judgmental, no? Wag mong sabihin sa pasyente mo, kaya naman pala inuubo, lakas mo palang manigarilyo. So, yes, alam natin that the cause is the smoking. So, you can do it later. You can give health teaching later, pero dapat hindi ka mag-sound as judgmental. Or you are doing a cross-examination, very personal na yung mga tinatanong mong questions. Baka below the belt na yan. Or you're giving unwanted advice to the client that is not, again, related to the problem of your client. Or you are using technical terms like mga medical term. Sabihin mo kay patient, o uminom ka na lang ng biogesic PRN. So what do you mean by PRN? So the patient will not understand our medical term. So you have to use words that are that can be understood by your client, no, up to the level of your client. Okay, and then the professional characteristics to enhance the nurse-patient interaction involves or include the following, no? Positive regard. So, ano ba yung example ng ating positive regard? Okay, so you have to ask a welcoming questions, okay, to the client. Parang hini-help mo yung client na mag-voice out ng worries, ng struggles, ayan. And then empathy. You are showing understanding to the client. You acknowledge the struggle of the client, or you express gratitude to the client, and then you support and encourage the client. Genuineness. You are being real. You're being a real person, and you're only asking real question. And then concreteness. You are very naging specific ka, naging clear ka doon sa patient mo. And then that actually ends our topic for this week. Thank you everyone again for listening or watching this presentation. So I hope that what you have learned from our chapter 1 to 3 will be applied in doing your health assessment or in doing your nursing care plan or patient care in the future. So God bless everyone. See you again next week. And lastly, the references of our presentation.